This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Perfect. Awesome. Okay. All right. So, hey everybody. Thank you so much to PM&R Scholars for giving our program a chance to talk about ourselves and what our program offers. So my name is Martin Laguerre. I am a PGY4 PM&R resident at UT Southwestern. I am the Research and Development Chief. For this talk, I'll keep it very informal, really an informal overview of our program. Feel free to stop me anytime, and I'll try to do my best in terms of the chat to kind of monitor that and look for questions. Okay, so the UT Southwestern PM&R residency program started in about 1977. We got accredited a year later. So we are one of the largest PM&R residency programs with 9 residents a year. We are a categorical and advanced residency program. We have 6 categorical spots, those which that do intern year here at UT Southwestern, and 3 advanced spots where the intern year is done elsewhere and the residents come in as PGY2s. So I couples matched here with my wife. She's in pediatrics, into a categorical spot here. In terms of a decent amount of the advantages of our program, and we're going to be going through this like throughout the presentation, but I think because we're such a large program, we have a really diverse faculty. We have, in terms of like the Dallas-Fort Worth, DFW area, we have an extremely kind of diverse patient population. And in terms of like, we have a number of different rotation spots that we rotate at, which kind of helps us in terms of the diversity of patients that we see. We also, in terms of just having a large residency as well, it helps us in terms of like just having a large opportunity for a lot of hands-on fluoroscopic ultrasound, pretty much the gambit of procedures that we do in PM&R. Additionally, like one of the benefits of us having a very large residency program is that our call schedule is very, very, very manageable, like compared to other programs. I think that's just one of the large benefits that we have. All right, so one big draw of the program is Dallas itself. So myself, I'm from South Florida. So the weather here is much less like you're living in a sauna, and kind of more, although kind of summer Dallas has been doing its best Florida impression, but I have been very, very happy with the weather here. It's a great climate. It's a large city with a myriad of attractions, parks, diverse restaurants, and in being like a metropolitan area compared to a lot of other places, like the traffic is very, very reasonable here compared to a lot of other big cities. Additionally, living in Texas, we don't have any state tax, which is very, very nice as a resident. Okay, so moving on to the actual program itself. So for intern year, I'll talk about this. I did intern year here, and I think our intern year is wonderful in terms of preparing you for PM&R residency. It's a challenging year as you're just getting used to being a doctor, but I think it's a varied year, and we have a number of rotations that we kind of do that help set you up for success later on down the line. So in terms of like rotations, we have internal medicine wards, we have emergency medicine. We do a fair amount of neurology and neurocritical care, which kind of helps in a lot of the different patients and pathologies that we see here in PM&R. We do a month of surgery, split up into 2 weeks of trauma and 2 weeks of burn, both of which kind of help us because a lot of the patients that we see in terms of our polytrauma patients as well as our burn patients, it helps us to see the entire like spectrum of care from like the onset of injury until kind of like their rehabilitation needs. Additionally, we also offer, and this is one thing that's kind of like unique for our intern year, is that we do have exposure to our PM&R clinics, and so you do get to kind of like just get a taste of kind of like what's to come in the years 2 through 4. Which is very nice. It's just nice to kind of know what you're kind of building yourself, what all of this kind of hard work that you're doing on internal medicine wards, on neurology, on surgery, that's building up to. Okay, so now I'll talk about kind of like some of the different hospitals that we rotate through, and I'll kind of give you a just a sense of kind of like how diverse kind of like our experience is. So one of our first hospitals I'll talk about is Parkland, which is our kind of community public hospital. It's a level 1 trauma center. We have an inpatient rehab unit up on the top floor. It's probably the nicest like public community hospital that I have ever been in. It's very nice that we get to spend a lot of time here in our clinics as well as like the rehab unit doing consults. And particularly for this hospital, because it's like a kind of community catch-all hospital, we get to treat a lot of wide array of patients in terms of patients who are uninsured, underinsured, patients who, because we are very, very close to the border with Mexico, we do get a lot of different immigrants who come through here. So that's one patient population that like we really, really enjoy kind of serving, and it really helps in terms of our knowledge. Another hospital that we rotate through is one of the ones that is affiliated with UT Southwestern. One of our academic hospitals is Zale Lipsche, where we have 2 rehab floors in addition to various clinics. It's currently undergoing renovation, so it's kind of it's starting to become like a little bit more beautiful, but it's still been very nice, and we still through the renovations, like we still have a ton of patients who are there. We see, because of our association with UT Southwestern and because it's a very large academic center, we get to see in terms of our inpatient rehab experience, we get to see a lot of different varieties of pathologies, ones that you wouldn't necessarily see in terms of inpatient rehabilitation, such as left ventricular assist devices. We get to see them and take care of them for their rehab stays, as well as like a lot of different transplants, which, because we have a very, very close relationship with our pulmonary transplant doctors, with our liver transplant doctors, with our kidney transplant doctors. That's one of the more unique kind of patients that we get to take care of. And then we have our the big UT Southwestern hospital, Clements, which is gigantic. It has probably like 900 beds. It is absolutely massive. Here we don't have a inpatient rehab unit. We do consults, and we get to see a lot of those patients that will then kind of refer for rehab, and then we'll get to a lot of those patients end up choosing UT Southwestern Zale to kind of stay in the UT Southwestern system. So it is nice in terms of a continuity of care to be able to see these patients at our very, very large hospital and kind of see them transfer into our rehab hospital. It's very rewarding in that way. Then we have the North Texas VA, which is again, this is going to be kind of a theme in terms of our hospitals, is that it's one of the largest VAs in the country. Here we see a variety of veterans. We have a variety of spinal cord faculty, as well as traumatic brain injury faculty, as well as musculoskeletal faculty. So with this population, there's a lot of like kind of unique aspects that we see in terms of like our veterans who have been in like overseas and who've either like suffered like explosion injuries. Seeing them in terms of like their spinal cord injury course and their traumatic brain injury course is something that I have particularly found just like extremely rewarding. Then we have our Children's Medical Center, which is that's where my wife works. And but this is where, so we have a pediatric rehabilitation center that's inside of Children's. We're consultants there, as we kind of, for us, usually we don't have like the pediatric training, so we don't kind of like staff that rehabilitation unit on our own. We kind of have our pediatric friends to be able to help us out in terms of all troubleshooting with those patients. But because we have a pediatric rehab unit, I feel like we get to see a lot of different pediatric pathologies, which is fairly unique as it's a relatively smaller kind of field of PM&R, but it's well represented in our program. Then we have Texas Presbyterian, which is kind of where you get to see more private inpatient hospital. It helps in terms of kind of being able to see all these like kind of different locations, and it helps in terms of future planning to kind of think about where you'll want to practice like in the future. Getting all this different experiences with all these patients and at all these different locations is something I've definitely that we're very fortunate to have here. Additionally, we do have like a number of clinics kind of throughout the Dallas-Fort Worth area. I won't go through all of these, but the advantages of having kind of these clinics is that you get to see things that you don't necessarily get to see like in terms of like large academic kind of clinics. So in a lot of like, for example, say in our sports medicine, our musculoskeletal clinics, like we get to see different types of interventions, such as like PRP injections, which is just like a whole population in of itself. And kind of just going on with the point of that we're a very large program, is that we just kind of run the gambit in terms of all the subspecialties in terms of spine pain, MSK sports, pelvic floor, cancer rehab, traumatic brain injury medicine, pediatric medicine, wound care, burns, spasticity. We represent probably the majority of PM&R subspecialties. In terms of our kind of core curriculum, so we are in the process of kind of revamping this right now. So right now we have a 12-month curriculum. We have protected time every Friday morning, which are from 8 a.m. to 11 a.m. on Friday mornings, which our program director is incredibly committed to making sure that that is a protected period of time, that we're not getting paged, we're not getting dragged to different things in terms of patient care, that is our time to learn and to have these lectures and have this time to like have our academic time. We have had, in terms of like just our lecture series, going through like the different the PM&R subspecialties, we also do a lot of ultrasound, and we have a fairly robust ultrasound curriculum, kind of breaking down each joint and each kind of each joint into its ultrasound components that you'd want to kind of like see on a diagnostic evaluation. So that's one thing that has been implemented, and it's been fantastic. Additionally,
give a 5-minute warning, Martin.
What? Oh, it's a 5-minute
minute.
warning. Oh,
Yep.
let me go faster. Sorry about that. Okay, we're really, really hands-on. So we have a whole bunch of procedures that we can do. We have fairs. We have down here is kind of this Botox fair that we have. There's a Paralympic swimming up there. In terms of unique experiences, one of our faculty here is the team doctor for US water polo. So this is one of our residents being able to kind of work with him. There's kind of adaptive sports that we have a large component with. Just get a lot of workshops, a lot of cadaver labs in terms of doing different fluoroscopic and ultrasound procedures, which is great. In terms of research, I know I'm gonna get off on that, but we're a model system in terms of burn and traumatic brain injury, which gives us a large database. We have Shark Tank, which helps us in terms of getting funding for all of our research. And then in terms of camaraderie, we all have fun with each other. We hang out outside of residency. One of my co-residents, we were just having a barbecue at his house where he made the best brisket of all time. And yeah, no, I know I had to rush through half that last half, but thank you guys for listening so much. And I'll take any questions that you guys have. Now let me look in the chat. Okay. Okay. That information for. All right, so I'm seeing in these questions, so opportunity for research for practicing or practicing for students like me who have definitely, we have a whole, we have a faculty that serves as our medical student liaison, and they kind of work with me, like the research chief, in terms of coordinating research throughout our department with our medical students. And we've had a number of medical students who've been able to go to PM&R and present their research and be able to have publications. Which procedures you feel you get most comfortable with during residency? So we get very comfortable in terms of our peripheral joint injections. We get very comfortable in terms of our ultrasound evaluation. We get very comfortable in terms of our Botox injections, managing kind of troubleshooting different issues in terms of interthecal baclofen pumps, refilling those interthecal baclofen pumps, fluoroscopic procedures. I'm not going into a spine or a pain fellowship, but we still do get the opportunity to have a lot of exposure in the fluoro suite and to be able to kind of perform those injections ourselves.
Martin, I hate to cut you off
EMG
again. 2-minute warning. If anyone wants to, Martin, if you could put your contact information.
Yeah, yes. EMR used, that is Epic, except for VA, which is CPRS. Sorry, Shark Tank. Dang it. I am not going to get through to all these questions, my guys, but please email me. I always remember what it's like, kind of being in this situation. Feel free to email me about anything. If you have any questions about a program, questions about couples matching, questions about whichever. Let's see. Shark Tank. Shark Tank's its whole thing, but it's kind of like the show, except you're pitching research projects, but people aren't mean to you like on Shark Tank. It's more kind of just to develop your research call schedule. In terms of that, we work on a night float system, so we have 6 weeks of night float. 3 weeks of night float in PGY2 and PGY3, and then six total calls in addition to those. And leadership opportunities, we have a number of committees that we have in terms of our ACGME House Staff Committee, we have a Wellness Committee, we have a number of committees that we have representatives through AAPM&R and AAP. Formal internal mentoring program. Yes, we do. We have
I'm sorry to cut you off, Martin, but we've reached the limit for the presentation. We have to move on to the next program.
No worries. All right. Thank you guys so much.
Thank you so much, Martin. I really appreciate you.
All right. Bye.